What we're proposing here today is a new dedicated funding stream, $1 million a year to every rural emergency room in the United States of America.
I think is a really brilliant way to have designed this bill to ensure that the infusion of funds is consistent and that it's not just for a couple years.
Welcome to the Built on Results podcast, a series of conversations about the issues, the advocacy, and the wins on behalf of emergency physicians. Today, a special edition of the podcast covering the announcement this week of the Rural Hospital Emergency Department Guarantee Act. Missouri Senator Josh Hawley announced the bill on Wednesday, June 24th. It guarantees $1 million a year for 10 years to eligible emergency departments in rural communities. We begin our coverage with Senator Hawley's comments at the bill's unveiling on Capitol Hill.
We're here today to talk about a problem that's confronting every place in the United States of America and certainly every community in the state of Missouri. Everybody in America knows that healthcare costs too much. It's too expensive. It's too difficult to get the kind of care that you need. But I tell you what is even worse than the cost, it's not being able to access care at all. And in too many communities in the state of Missouri, and I would be willing to bet around the country, too many patients cannot get access to critical emergency care when they need it most. I'll give you an example. In Missouri, over the last 12 years, 12 rural hospital emergency rooms have closed, one a year, and the trend line continues. We now have multiple counties in the state of Missouri, in fact, it's 40, that do not have a rural hospital emergency room of any kind. In fact, the average drive time in rural Missouri now to get to an emergency room is 30 miles. You think about that. 30 miles. So what? Under the best of circumstances, that's 30 minutes to get there. Under the best of circumstances. And that's if your county has a rural hospital with an emergency room relatively nearby. If you're having an acute crisis, if you're having a cardiac event, if your child has been seriously injured, those 30 miles are the difference between life and death. And to see one emergency room after another close in my state and around the country is absolutely unacceptable. And that's why we're here today. We're here today to talk about the vital importance of emergency care in the United States, and we're here to do something about it. And I'll just cut straight to the chase. There's so many programs in the federal government, there's so many grants, there's so many different so-called funding streams. It's time to do an end run around all of those. That's all fine, and we want every hospital in the state of Missouri and in America to get every dollar that they can that will help them keep their doors open. But here's what we propose today. We propose today to create a dedicated support for every rural emergency room in the United States of America. We don't want to see another emergency room in rural America close. Not one. We've lost too many in Missouri. We've lost too many nationwide. So what this legislation would do, it would create for the first time a new program that is very simple. It would provide $1 million a year to rural hospitals with emergency rooms in every state in the United States of America. And if that hospital and that emergency room were in dire need and suffering serious consequences, facing very difficult circumstances, under this program they would have the ability to ask for emergency payments of up to 50% more on an annual basis. But it's very, very simple. It's not a grant program. You don't have to reapply for it every year. You do have to certify that you're actually in a rural area. You do have to meet the federal specifications. It can't go to CEO pay. It can't go to pay private equity. It is for doctors and nurses and critical staff in our rural hospitals to provide that critical care. And I just want to emphasize something that I think should be obvious, and I know that every Missourian understands. You can't replace an emergency room. You can't replace it with an algorithm. You can't replace it with a phone call. Telehealth is wonderful, but you can't replace an emergency room with telehealth. And for too long, we've heard from so-called experts in this building and in this Capitol that they know what's best for rural America, even though many of them have never been to rural America, and certainly not to rural Missouri. We've heard that, well, we could do without a lot of these rural hospitals and emergency rooms because, they don't make enough money, they are over budget, they don't serve enough people. Every life in my state is a life worth fighting for and worth saving. And as someone who grew up in a rural county, in a rural town with a rural hospital, and somebody who visited it on more than one occasion, I can say, I was a very good client of that hospital. I just want to say thank you to the doctors who treated me, including on an emergency basis in that hospital. I want to say thank you to the doctors over the years who in all of our rural counties and towns across the state of Missouri and across the country have dedicated their lives. And I want to say that you're needed. You are needed, you are vital, and it is time that we made a commitment as a nation to protect these doctors in these emergency rooms so that we can serve the people of the United States. Rural America is not second-class America. I think sometimes people in this building forget that. And sometimes people in this Capitol forget that. Just because you live in a small town doesn't mean that your life or your health care or your children's lives or health care is less valuable. Too often it means that you're forgotten. Well, not anymore, not after the legislation that we're introducing today. I want to introduce to you now some terrific people who are here with me, wonderful folks who are providing this care, this critical care that we want to make sure every Missourian and every American has access to. And I want to say before I introduce them and give them the opportunity to talk, I'm delighted that this legislation is already bipartisan. We're just introducing it today. My friend Senator Maggie Hassan is my co-sponsor on the Democrat side of the aisle, and I hope that every senator in the United States Senate will join this legislation. Every senator should be for this. There's nothing political about it. There's nothing controversial about it. There's no hidden agenda here. It's just about keeping emergency rooms open. Surely, whatever else you think about healthcare in America, surely we can agree on that emergency rooms in this country, emergency rooms in rural places in this country should be open and available, there to treat our children and our grandparents and our family members and those in need.
ACEP past president Dr. Aisha Terry attended the news conference where Senator Hawley announced the proposal. We spoke with her about ACEP's support for the legislation.
ACEP thinks that this is an outstanding step in the right direction to give our rural patients the support that they need in order to thrive. We are absolutely standing up for and supporting this piece of legislation as, in fact, in many ways, it's actually overdue. The individuals who live in rural populations in this country certainly deserve access to care like all of us. And so we are very excited about supporting this piece of legislation.
And so many rural hospitals have closed in the last several years. This really is a crisis.
It really is a crisis, and it has been, again, for some time now. I think the momentum is there now to try to really push this across the finish line, along with some other efforts and initiatives like the Rural Health Transformation Project, et cetera. And so I think that right now is an optimal time to really continue to shine a light on this problem around hospital closures. We know that over the next decade or so, it's estimated that there'll be over 100 or so rural hospitals that have to close their doors, and that would leave about 3 million patients without access to care.
The bill is prescriptive. It says that the money can't be spent in the front office. It has to be spent in the emergency department. That's a positive thing.
I think that's definitely a positive thing. I think earmarking funds to ensure that it gets to the right people at the right time and stays in the right hands is absolutely imperative.
Thinking about all of your work in emergency medicine and the things that you have been exposed to over the course of your career, what are some of the other options? I mean, this is one solution, but there are others. Can you summarize some of those that are on the table now or things we ought to be thinking about?
Yeah, absolutely. Again, I think that one of the key pieces here will be to look at it from a comprehensive lens. And so while the funding will be absolutely important and necessary and go a really long way, it's important to think about it as a whole. And we know that our rural populations face all kinds of disparities and inequities and needs, if you will. So, for example, when it comes to workforce shortages, we know that for many years we've had a problem with getting adequately trained physicians and clinicians to rural settings to take care of patients. And so another key piece will be ensuring that the workforce in rural America is strong through initiatives, whether that be loan repayment options or otherwise, to really incentivize people to take care of our rural populations. Another key piece to think about is that, unfortunately, we know that our rural patients, unfortunately, tend to suffer more when it comes to just health problems in general, that they tend to, unfortunately, die earlier than other populations of individuals. They lack access to care through adequate insurance, and they also suffer from, for example, delays when it comes to screenings and the like that can really discover medical problems in advance to be able to actually solve them. And so this is another piece that we certainly should consider, and that is just making sure that there are the on-the-ground resources that patients need in order to have the care that will allow them to thrive and actually live long, healthy lives.
This bill says an eligible emergency department could get $1 million a year for 10 years, so that's $10 million if this program were passed by Congress and signed by the president. What sort of impact could $10 million make in a rural community?
Oh, it could go a really long way, actually. We know that the cost of living tends to be lower in these communities, and so to ensure that there is not just a single bolus, if you will, of funds, but that it persists and is consistent over the years, I think is a really brilliant way to have designed this bill to ensure that the infusion of funds is consistent and that it's not just for a couple years, but 10 years is certainly a reasonable amount of time to at least give these hospitals the leverage that they need to get back on their feet and to grow in a way that allows them to be sustained.
The bill has bipartisan support. Senator Maggie Hassan from New Hampshire is an original co-sponsor. You can listen to more conversations about ACEP's work on issues important to emergency physicians by clicking the links in the show notes of each episode on this channel. There's also a website, acep.org/results. This is where you can get the latest updates about ACEP's advocacy work. Anytime there's a development or a win to share, you'll find it here. The best way to stay up to date is to follow the Built on Results podcast on your favorite podcast player. Apple, Spotify, and Amazon are the top channels, but there are more than 150, so you can take your pick because we're on all of them. Thank you for listening to the Built on Results podcast, a production of the American College of Emergency Physicians. We're back every time there's news. Until then, have a great day.